This is Megan Antonelli with Health Impact Live. And today we have a very special guest joining us. Joe Zakaria is the Vice President of Strategy Finance at Natera, a leading company in contactless remote patient monitoring and a Health Impact partner. Joe has been with Natera since 2018, bringing his expertise and passion for revolutionizing healthcare delivery through innovative technology. Remote patient monitoring offers a revolutionary approach to healthcare and enables continuous and real-time monitoring of patients' vital signs and health parameters beyond traditional clinical settings. Natera is at the forefront of this transformation. A graduate of the Johns Hopkins University, Joe earned his BA in political science and was member of the varsity baseball team, no doubt showcasing his dedication and teamwork skills both on and off the field. Growing up in Long Island, Joe developed a strong sense of community and a desire to make a positive impact on people's lives. This led him to pursue a career in healthcare, where he could combine his business acumen with his commitment to improving patient outcomes. So let's dive in and learn a little bit more about the future of patient care in the digital health era, where RPM is said to play a pivotal role in enhancing the quality and accessibility of healthcare services. Hi, Joe. Welcome to the show.
Hi, Megan, thanks for having us. I really appreciate it.
Yeah, absolutely. Well, it's been great to finally get to know you and learn about your background. I'm, an East Coast girl myself, so love Long Island and sort of the Baltimore area. Um,
Yeah.
Tell us a little bit about Natera and the RPM platform and how it's different from the traditional remote monitoring solutions.
Yeah. So, we're, as you know, an Israeli company. And I think one of the things that we try to pride ourselves on is taking non-traditional technologies and applying them to markets and opportunities where we think we can deliver change. When we set out on this journey, we realized that there was this big gap. We called it the digital to analog gap, where the body is an analog being, but there was so much opportunity to do things digitally speaking. But we had to figure out how to connect those two seamlessly. So we set out on a technology that we know well in the sensor market, and we tried to pair it and deliver it as a platform, right? So something that you can start with but grow with, and it sort of allows you to take on newer technologies, newer capabilities, and deliver care in a non-traditional way. Um, for us, the contactless nature was really key. We sort of had this thought that if you had to remember to wear it or charge it or bring it somewhere, ultimately you couldn't rely on it. So we set out with that in mind, and we needed to be able to deliver clinical grade information in order for it really to get an adoption in that space. Um, I think some of the things that we tried to make sure was that it didn't require any specific activities by the patient or the clinicians to get the information we needed. Some of the other technologies out there require people to sit still, or they require them to wear something, or they require them to have a special clothing or be in a particular area. We wanted to be as dynamic as possible. So it was a real life situation where people had the opportunity to really get the most out of the technology.
Yeah. Well, that's great. I think, you think of when you're in a hospital setting and how often you're kind of disturbed to
Yeah.
get those vitals checked. So tell us a little bit in terms of for the patients, I guess that's one key benefit of being contactless. What about nurses and the hospital, the healthcare facilities themselves? What are some of those key benefits?
I think the first one that typically comes to mind is, people can't have eyes and ears everywhere. So what we wanted to do was, and we call it a DNA, right? A digital nursing assistant, something that is kind of eyes and ears in a patient's room, that allows the staff to be able to have peace of mind that while they're treating somebody else or taking care of somebody, that everybody else is okay. And if something changes, they have the opportunity to be reactive on it. And I think that that workflow, where it's out of sight, out of mind, but also it's there for you, and you can rely on and trust on it because of the certifications and the FDA qualifications that we've gone through, really just gives a peace of mind in the care.
Tell me a little bit more about what that looks like. I mean, if you're a nurse sitting at sitting at the command center or where they're monitoring it, how does that, interplay with their workflow?
Yeah, so I think one of the things we thought early on was that we had to deliver the information we had where the clinicians were accustomed to getting it. That's typically in an EHR. It's typically in a dashboard setting that they may have at the nurse's station, or they may, the newer models are also some central command where there's a group of people that are kind of the eyes and ears across the entire organization. So our thought process was, look, early on, people are going to be hesitant to go through this adoption into the EHR system. It's a cumbersome lift. So we're going to create a dashboard. We're going to create a workflow. We're going to allow them to use our technology. But what we see is that we start there, and ultimately we evolve and deliver that data into an EHR or into a command center where they can get more out of it because it's where they live and breathe on a daily basis with their patients.
Right. Well, that makes a lot of sense. And certainly, we hear about, there's applications and the integration with EHR and how important that is. What about from the workflow, for burnout for health systems that are looking at their clinicians who are getting, so many notifications? What does that look like? How are they getting the information within that platform that they're already in?
Yeah, so alert fatigue is something I think we very early on recognized that if we're just another beeping device, nobody's going to want this in their facility. It's not going to matter how helpful it is. We need to deliver actionable things that nurses could trust. And if the alarm went off, they attended to it. Because otherwise they would just, hit the ignore button, and then it really doesn't do what it needs to do. We can deliver this in any way, shape, or form. If you're using our dashboard, there's an audio and visual effect on the dashboard to show that, Mr. Jones in room 200 needs attention. But at the same time, if it's coming through an Epic platform where they were getting an alert system, then we can deliver it there. The goal is ultimately to get the information that's needed to the clinician where they are, where they're accustomed to using it, without having to do something specific to Natera and the way, we think that the business should be done.
Right. Amazing. So, and we've heard a lot lately about, cybersecurity with the recent change in, incident and things. Tell us a little bit
Yeah.
about, how that data is moving from place to place, where, and how you guys are protecting patient privacy and data security.
Yeah, so it's interesting because normally when you think about patient privacy, you think about the in the hospital piece of the privacy, and that's core to what we do, right? There's no cameras in our system, there's no microphones in our system. It's a sensor that's measuring movements of the body. So inherently, the device is designed to be respectful of patient privacy. They can change, they can have, they can be eating, they can practice religious things. There's nothing that they have to worry about from a behavioral aspect, because our sensor is not watching them, right? It's monitoring their movements. But to your earlier point about cybersecurity, in order to make our data as smart as possible, we have to use it in a way where we're processing it, and extracting the most out of it. And cybersecurity is something we try to differentiate ourselves from some of the competitors. We don't send any PHI up to be processed, right? It's just a raw signal that we send up there. It's all encrypted. There's multi-factor authentication. We're working with some really novel cybersecurity players on rights access and certain things to make sure that the people who are using the data and getting access to the data are in fact only the people that are supposed to have it. So we take that very, very seriously at Natera.
That's great. And it gets into the privacy piece is really interesting to me. We've heard, we're hearing a lot as now, AI is being implemented and used by health systems. And there's a lot of discussion about, where does the patient get a choice? You don't give the patient a choice to say, we're going to use a Stryker device versus but now we're getting into this discussion, and certainly we've seen it with Alexa, right? Alexa's in the room, and do you want them off? Do you want them on, giving people those decision points, and, where does that come in to this? And do you have any thoughts? And have you guys gone through that process in terms of that, or is it because it's a monitoring device and not, filming the patient, that some of that sensitivity is already managed?
We typically, the customers that we have, whether they be hospital partners or long-term care, they typically have a designed process for that, right? To your earlier point, you don't get to choose whether you have a GE, or a Baxter infusion or a Stryker or a Medtronic. It's the device that the hospital has chosen to use. In the long-term care setting, because typically these are people's homes to a certain degree, it's a different element there. But what we found is that once they understand that this is not recording them and this is there to help the staff, and for them to get interrupted less often and not get woken up in the nighttime or things like that, the families are really excited about it. The patients ultimately get very excited about it. But it's really, it's a medical tool. It's a medical device, and it's intended to be used just like your traditional bedside monitoring devices, just a little bit easier, for everybody involved because of the passive nature of it.
Right. So ultimately, certainly in that setting in long-term care, it's a patient value, right? I mean, they
Yep.
appreciate it. It's less work for them. It's less work for their caretaker. So that benefit far outweighs the discussion
You know,
around.
the other cool thing, which we sort of I don't want to say stumbled upon, but we realized early on is there's a lot of behavioral elements that our system catches just by virtue of how many times did somebody get out of bed, or have they rolled over? Do they need to be moved by a nurse to avoid a pressure ulcer? Did they get up 5 times in the middle of the night to use the bathroom? Maybe they have a UTI infection that nobody knows about. So we've actually found that there's some behavioral elements that we didn't even kind of design the system to be looking for. But once we realized that they were there, we then layer on our algorithms and our knowledge of sort of the patient bedside mannerisms to get more informed information and paint that holistic picture, which is ultimately what we're trying to get to anyway, right? We're trying to
Right.
get to a holistic patient view where we're being proactive in the care instead of reactive in the care, and giving, clinicians and caregivers insights that they may have not already had, and things they had to ask and pry for, are now kind of delivered to them because it's being captured contactlessly.
Right. So, I mean, in talking about that and in that holistic view, in terms of how the tool, obviously an acute setting where, something needs to be managed right away, and the physicians and clinicians are alerted, that value add is there. It's
Yeah.
replacing other things that are more cumbersome for the patient. But from a more holistic view and a long-term view, what are some of the values or benefits of the tool from that perspective?
Yeah, so to that point, we've designed it to sort of work in two ways, right? It's that long-term patient view, what's happening day over day, week over week, month over month, what's happening from a baseline perspective. Is their resting heart rate gradually increasing? Is something going on? Is their breathing becoming more laborious? That those subtle things that you don't pick up on a week by week basis or a month by month basis are typically indicative of something changing in the body. The body, if you got a fever, right, your underlying vital signs are going to change. So these are things that you may not pick up on acutely, to your point, because it's happening gradually, but there are changes that need to be identified. On the flip side, if something happens very fast, you want to know, and the alert mechanisms that we've designed work both ways, right? So we have absolute thresholds that doctors can set to say, if their heart rate crosses 140, I want to know. If it falls below 50, I want to know. But at the same time, if their heart rate goes from 85 to 95, well, maybe that's just because they moved over or they slid up and they got back from the bathroom. Like, we don't want to
Mhm.
trigger something that's a change off of their baseline if it's in line with the expected behaviors. So we've designed the system to work both ways, right? It learns the baseline, it establishes it. So we're not triggering alerts that are not actionable and meaningful. But at the same time, there's that safety mechanism of, if something happens, we know that we can act on it.
Great. Yeah, that makes total sense. What about from the patient side? Are they able to see the information? Do they have access to the information?
Again, it really depends. I mean, I think a lot of people, do you wear a smartwatch, or I
Mhm.
have an Apple Watch on. I think I like to look at the long-term trends to see where I'm going from a health perspective, but sometimes the data is a little bit overwhelming and you don't really know what to do with it. So we give the customers the option to have the data shareable with the customers or the patients, but it's not something we actively push because I think the population we're trying to serve is not necessarily looking for that level of detail, but it's there if they want it. And I think as we move towards aging at home and hospital at home and home care and shortening hospital stays using this kind of technology, ultimately we want to be able to deliver that data to them in that manner, because that's going to be, they're not going to have the clinical oversight on a day-to-day basis, but they're going to want to know what's going on.
Right. Yeah, no, absolutely. I have all the devices. I have my Apple Watch and my Aura Ring, and it is. I mean, the Ring I think has been one of the more impactful, knowledge. But yes, again, it's like monitoring health and versus when you're monitoring when you're sick. It's you're looking for different indicators, and
Yeah.
it's a different window, right? And there's a
So
certain.
I would be willing to bet that the information that's most valuable out of your Aura Ring is probably what you get overnight. And because you're not wearing your Apple Watch. And the cool thing about our technology, right, is it's monitoring you while you're sleeping and it's monitoring you when you're in the location where you typically are. So what that does is it removes a whole host of variables and it allows you to really drill down to what is fundamentally going on, at a baseline level, and then seeing where that change happens. And I
Right.
think that's really where we try to be different, from the competitors in the space.
Mm-hmm. That's great. Well, let's talk a little bit about that and sort of some of the maybe share with me a little bit of the case studies of where you've been
Yeah.
implemented and some of the value propositions that have happened there.
Yeah, so we operate in three distinct arenas today, right? The hospital environment in your typical nursing environment, a med surge, a step down, something like that. And that's where, um, you know, we don't see as many of the outcomes because they're acted on early and folks they get the care they need early on. It's that proactive versus reactive care that we touched on a little bit earlier. But in long-term care, we're really seeing, these facilities are typically, they don't have something before that we're replacing. This is a new tool for them. And that's where we're seeing some of the most dramatic impacts. It's what do we not know that we now know that we can act on? And one of our largest customers and us did a study over a period of 2 months at 6 locations, and we delivered 174, actionable alerts in that time, and 163 of them were able to be treated in place. So it's a 94-ish% treat in place ratio, which is I think if you were to go to most operators of long-term care and you told them we had the opportunity to keep, 90+% of their patients in the facility, they'd be like, show me where to sign. It's not only good for the facility, it's good for the families, it's good for the patients, it's good for the bottom line. It's really it's a cyclical impact across the organization. And then we do some cool work in the drug and alcohol rehab arena. And this is an area we didn't really know a whole lot about going into, but we had a wonderful team that we worked with on site to really understand the nuances of their needs. And we've had a couple of instances where they have told us flat out, we would have lost this person if we didn't have the information, you guys provided us. And one that always comes to mind is something that I had never heard of before, which is acute encephalitis. They had a patient who was kind of walking around and a little bit dazed, and they weren't sure what was going on. And then he got back into his bed, and they saw a pretty significant spike in his respiratory rate, and a drop in his heart rate. And they went to check on him, and he really wasn't doing well. So they rushed him to the hospital, and he ended up being diagnosed with this acute encephalitis, which is if I'm not mistaken, a liver related disease. And they told us, if we hadn't known this in 30 minutes, he probably would have died. So again, it's just this acute, actionable information, and also these long-term trends, which people otherwise wouldn't have had access to.
Right, particularly in that long-term care setting
Yeah.
and in the rehab setting for sure. So tell me, I mean, in terms of, the challenges, right? I mean, we like to kind of move beyond the hype of all these technologies and look at like when you're a health system, when you're a long-term care facility and you're looking at implementing these tools, what are the challenges that they should be aware of as they set forth into it? And how do they avoid those, what could be, sort of bottlenecks or barriers to implementation and adoption?
I think it goes back to education, patient education, staff education, and just education of folks in the various facilities. Like I said, specifically in long-term care, these are environments where they haven't had this type of insight before. And staff is a little bit weary about what is the oversight. Is this something that, they're going to be checking on me about? So it's really early education to get the staff accustomed to what is this technology? What does it do? What does it not do? And the other interesting thing that we found over time is, especially in long-term care, a lot of these people, this is their home. This is where they live. This is where their family comes and visits them. There's pictures of their grandkids on the wall. But the staff becomes their second family, right? So these are the people they trust and they look up to. So educating the staff to help give a level of comfort to the patients, which then translates to the families, allows that cyclical information where you get the data you want, you trust the data you want, you trust that this is there for your benefit and not a watchful eye that, someone's going to say, well, you didn't do this or you didn't do that. We're there to help. And in order to do that, we need to get everybody on board and understanding of that. That's really the biggest thing. I think the technology and the outcomes speak for themselves. It's just getting a non-traditional technology in a non-traditional environment and people to just, be okay with it.
Mm-hmm. Yeah. I mean, people in healthcare particularly, there's that resistance to change and risk and rightfully so. But it is, it is funny that in this where that it is a tool, it's just, no one ever questions whether or not you're going to use a stethoscope, or
Yeah,
a
yeah,
blood
yeah,
pressure
yeah, yeah.
monitor. And
Yeah.
and this is just a new way of doing it. And it's a, new, innovative, novel way of doing it, better, faster, hopefully even cheaper, so it all comes
Yeah.
down to it.
Definitely cheaper. Definitely cheaper.
you know so it's interesting that way. Well, let's think about that. So as they come and they do get that education and they do the implementation, what does this look like as we move forward into the future? What does the new next smart hospital look like? What does patient care with remote patient monitoring look like?
From our perspective, we really want to see this shift to proactive care, identifying things earlier, intervening earlier, having less adverse outcomes, less readmissions. We want it to be a tool where the information that comes out, you trust, the care you are able to then provide is at a lower cost and less burdensome to the patients. And then I think ultimately what we believe is going to happen is the level of trust that's created from the system with the clinicians and the reduced adverse outcomes are going to give the facilities and the payers the comfort to send people home earlier or keep them home in certain instances. So we want to see shorter hospital stays. We want to see hospital at home. We want to see better telehealth products, right? Things where we can say we have this cool device, we trust it, we know it's accurate, we're going to deliver care where the patient is, so it's less costly to the institutions and it's less burdensome to the patients who need the care. And if you even think about like rural settings, right? This is the ultimate tool for a rural setting because sometimes you could be 2 or 3 hours from a clinic and you may not even need to go there. So there's this opportunity to really shift where the care is administered, but also where the monitoring takes place, and that the more you don't want to be in a hospital. You'd rather be at home, right? There's the TV's better, the food's better, the bed's better. You want to get into the environment you're most comfortable. That allows you to get better quicker, but it also gives people the ability to understand what's going on and do we need to intervene. So I think you'll see that shift out of the institutions and into the home, driven by the technology and the workflow enhancements that come with tech like ours.
Yeah, no, I mean, it really is. It's an amazing thing to think about as people want to be at home. I think I was just reading Susanna Fox's book about Rebel Health, and she talks in it about, how in the beginning, as hospitals started, people were still sort of dying at home. Then for years, it was all in the hospital, and now it's shifting. People don't want to be in the hospital, even at their end of life care. And, and then I
Yep.
also think about it, from a children's, pediatric perspective too. I mean, I happen to have a sister who has a young baby, and, they're sending them home now with these, sort of
Yeah.
monitors for RSV. And
Hmm.
she's very nervous about it, and they're great, but they make you a bit more, hyper vigilant about that, but
Yeah.
they want that, but I'm at this point where I'd like a radar device in our home to measure the child, just
Yeah.
so I know. So it's an interesting thing where you go from not only for the chronically ill, but for the healthy, there's a value to having these tools. And we, from a consumer perspective, are paying to put them on our hands regularly. So it is an interesting thing to think about the future state where that is monitored continuously, and what that would
Y-
mean.
Anecdotally, we've been approached by a couple people in the pediatric world, particularly in like the NICU settings or the PICU settings, where um, the first the work that those people do, they're like the true miracle workers of all miracle workers. There's a calm about them when you meet them that's really remarkable. But what we're finding there is that the little guys that are in that setting, it's traumatic for everybody, but when they get better and when they get home, all of a sudden there's nothing, right? You're used to having this watchful eye, whether it be staff or technologies or cameras on the children, and then when they go home, you all of a sudden don't have that, right?
Mhm.
It's getting up in the middle of the night. Are they breathing? I have two little ones, and I remember for each of them, there were times where they were sick, where my wife and I would get up in the middle of the night and walk in there just make sure, put your hand on their chest. But this can give you
Mine are
that sort of
13 and 19, and I still do it.
probably for different reasons, but
Yeah, right.
it's sort of that intermediary where, they no longer need an EKG all the time. But would you want to know that everything is stable? And if something does change, you have the ability to intervene. And I think that's where we are in that little sweet spot where we don't give you too much information if you don't need it, but
Mhm.
you're not blind. And it's really it's a cool dynamic to be able to deploy something so easily and so seamlessly that is dynamic and meant to grow and meant to be a platform and meant to layer on new features and behavioral aspects, that really is a I, I'm really, really excited for where we're going and what the capabilities that we have in our back pocket are.
Yeah, well, that's amazing. Me too. Me too. It's exciting
Thanks.
to see, and it's awesome just to see, finally, we've been at this for a long time, technology in healthcare, and it is, there's some real patient-centric technologies that are going to change, the patient experience, that
Yeah.
both will have better health outcomes and better experience for the patient. So tell me a little bit just in terms of, as you talk to your customers, what advice would you give to them as they seek this out, as they know this is a great technology, we want to have it. How do I get the champions within my organization to actually move on it?
I think, like anything else, you have to figure out what drives decisions in an organization. It's going to be a combination of getting the clinical team to want something new and different to deliver care differently. It's going to be to get the finance team to understand the cost reduction that can be associated not only with the product itself versus a traditional monitoring device, but also what is the outcome? What are the outcomes? Are we reducing hospitalizations? Are we getting less ER visits? And that all factors into the scoring that drives um, the finances behind the organization itself. So I think sort of the way our technology is holistic. I think the holistic view at an organizational level of understanding that it can touch all different elements, workflow, so staff burnout, reduce, getting nurses to working back at top of license and being by the bedside and talking with people instead of just taking vital signs and getting to know them, getting the numbers in terms of readmissions and ER trips down, and then also reducing costs. We're in an environment where the cost of healthcare is skyrocketing, yet the quality of the care sometimes is going the other direction. So we're trying to thread that needle where we can deliver better care to more people impact workflow and drive results on the bottom line.
Amazing. Well, I think that's all great, and I think all good reason to reach out and find out more and learn more. So tell us a little bit about how our audience can reach you and reach the team at Natera.
Yeah, so natera.com. You can typically find links to get in touch with us. I'm available by email. I'll share it with you. You can put it in the show notes, and the folks can reach out to us. Come visit us at conferences and various activities. We're happy to talk about it. We love what we're building, and we're excited for the future.
Yes, indeed. You guys will be at HealthIMPACT in June, and I look forward to it. So thank you, Joe, for sharing your valuable insights and telling us about the great work Natera is doing. And thank you for joining us on HealthIMPACT Live.
Natera's contactless FDA-cleared remote patient monitoring solution safely transforms patient care by monitoring vital signs and behavioral parameters without camera or microphone. The technology continuously monitors patients 24/7, uploading data virtually and automatically to capture vital signs and trending data based on pertinent findings at all times. Deteriorations and exacerbations may be detected early to allow for timely intervention. Natera's contactless sensor safely detects microskin displacements when patient breathes and as the heart beats. The collected data is sent to a HIPAA-compliant cloud, where it is computed into vital signs and displayed on a convenient dashboard, where the patient's data can be viewed by the telemedicine provider's clinician. The clinician receives notifications based on mutually set parameters and communicates with your point of contact as needed. For you, the staff working at the facility, that means a leaner workload, improved efficiency, reduced resident hospitalization, and enhanced patient care. Natera, enabling proactive care through continuous monitoring. For more information, don't hesitate to reach out to your clinical team from your telemedicine provider.